Did you know that in Canada, you can go to a pharmacist and get diagnosed and treated for many common minor ailments? And in Ontario, that list of minor ailments that you can be treated for just grew larger. So this is the list of conditions that pharmacists can diagnose and treat in Ontario. The top 13 there in this list have actually already been in place since the beginning of the year, and there have been about 400,000 different assessments already by pharmacists in Ontario. The bottom 6 were just added a few days ago. That includes nausea and vomiting in pregnancy, parasitic worms like pinworms, yeast infections, acne, canker sores, and diaper rash. So there has been a lot of debate about this, with doctors coming out on both sides of this debate. Some doctors saying that pharmacists really shouldn't be making these diagnoses and treatment decisions. They don't have the training, they don't have the right environment and tools to make these diagnoses. Other doctors saying, look, there just aren't enough family doctors to go around, and many people are waiting to find a family doctor or can't get in to see their family doctor. What's wrong with pharmacists dealing with these minor things so that the doctors can deal with the more serious conditions where they're truly needed? My view is that our health system is in a crisis state. Millions of Canadians don't have a family doctor. And if you empower pharmacists with the right tools to do this, I think that they are an underutilized part of our health system workforce. And so we need to measure this. We need to understand the impact on patients, make sure that this is safe and effective over time. We also need to measure the impact of this on access, because the benefit of this is hopefully to reduce the pressure on primary care so more people have access to their primary care physicians. But if we measure this and monitor this over time, hopefully we'll see that benefit. There's no denying that patients need better access. And right now, a lot of patients are going to places like emergency rooms for minor ailments, and that is backing up the system and preventing us from then dealing with the patients that have more serious conditions. So lots of change happening in our health system. This is happening not only in Ontario, but really across the country. And if you look around, it's happening around the world. Pharmacists are being empowered with more and more duties and responsibilities. So let's see what happens.